Hey guys, what's up? So I just want to do a quick update about my second opinion on my knee. If you haven't really heard or you haven't watched my other videos about my knee and what's going on with that, I'll link the video up here or down here somewhere so you can kind of get an update of whatever I'm talking about. But in a nutshell, just a slight summary. I had surgery about a year ago and I've been having ongoing issues ever since. I've had some swelling, pain, and about a month ago I finally hit my limit and made a doctor's appointment to go in and be like, hey, what's wrong? My knee is really swollen and painful. So they drained my knee, gave me a cortisone shot, ordered an MRI, and basically told me that my options are to take it easy and stop running, squatting, basically everything I enjoy and everything that has to do with bodybuilding or fitness. And of course there's always like different things you could do, and of course I could take it easy, but that's just not me. That is, I'm too young to stop doing these things, in my opinion. You know, these are the things that make me feel alive, so to tell me to stop doing these things just wasn't the greatest treatment option for me. He also mentioned the possibility, but yet not possibility, of stem cell injections because insurance doesn't cover them and they aren't really guaranteed to help. So I'm really hesitant to fork out $2,500 for something that may or may not help. And yeah, that's money I don't even have, so that's not even possible. The other option was a partial knee replacement, and I'm really hesitant to do a partial knee replacement considering those only last about 15 to 20 years. Then you have to have a full knee replacement, and those only last so long. So any doctor really is going to be hesitant to do any sort of implant that includes metal and plastic in someone who is in their 30s. The search began for a second opinion, and yeah, the other doc also kind of suggested that my hormones might have something to do with my arthritis in my left knee, just on my medial side, rather than like genetics or the fact that I had a basketball or sports injury in junior high. So that kind of rubbed me the wrong way. And I sought out a second opinion, and I sought out specifically a doctor who is more experienced with sports medicine, who is used to treating athletes or younger patients with arthritis or sports injuries. So on that note, I sought out Dr.Jamali. He's in Sacramento, and he's also based in Walnut Creek. I was really fortunate that I was able to get in pretty quickly due to already having a recent MRI and having just kind of seen another doctor. Usually he's booked out pretty far. So I saw him yesterday. He went over my MRIs, and his suggestion for me was actually something called a meniscus transplant. So I've had 3 total surgeries on my meniscus so far, so I have very little meniscus left. And he explained that basically my meniscus is non-functional at this moment, just because so much of it has been removed, and a lot of it is actually protruding out of my joint at this point, according to the MRI. So not only is it not functional, but it's also causing me some pain and swelling and arthritis, because without the meniscus, the cartilage doesn't really have protection. So say this is like your knee joint. This right here, yeah, this is really a weird motion. Your meniscus sits at the bottom of that joint. And so if this is my left knee, my medial meniscus over here is what's missing. Sorry, my dog is licking her asshole and it distracted me. Is that tasty? Yeah. Okay, anyways. So, his game plan, meniscus transplant, because these things are only things they do in patients that are under 50 without like severe arthritis, and it could buy me some time, like 10 years or so, until I would have to have a knee replacement. It's almost like getting a knee replacement or a new knee without getting a new knee, with metal and plastic. The transplant comes from a cadaver, so the tissue takes a while to actually get, and I think they have to make sure it like is a good fit. They take measurements from your MRI and stuff like that. I'll link it down below if you want to learn more about what a meniscus transplant is. And I told him that the options that were offered me were, not really something that I was happy about, and for him to offer this to me sounded like a good option. Of course, there's upsides and downsides of every surgery. One being that, like, you can, of course, re-tear the new meniscus and all that stuff, but he did say that it's usually not painful. So the ultimate thing that we're focusing on here is relieving the pain that I'm having, and this surgery will do that if all goes well. Of course, you can like reject the tissue, or you can contract some kind of disease from the donor, but they do testing on it to make sure that won't happen. Kind of like when you're given blood from a donor or like an organ from a donor. It's all kind of the same situation. I won't have to take any like medication to prevent rejection or anything like that. He did tell me that I could still have some swelling. He said hopefully it'll be temporary, but sometimes you can have ongoing swelling from things like that, but it won't be like painful like it is now. So that's like the gist of the update that I have for you right now. Meniscus transplant, or like cartilage transplant, which is a much better idea to me than a knee replacement at this time in my life. So I'm pretty stoked on that. I'm really happy that I decided to see this doctor that was able to offer me something a little bit more advanced instead of just like cut and paste knee replacement sort of situation. So that's where I'm at right now, getting the process started. He said it could take about 6 weeks to 3 months to get the tissues, the proper tissues from a donor. So I have a follow-up with him in about 6 weeks in December after my ball surgery. So a lot of stuff going on, a lot of surgeries. December 6th is still my ball surgery, and everything else that's going on with the arm and everything, which I think I'm feeling slightly down, which it's not like it's not a bad down, but it's kind of like I'm already anticipating the recoveries to all of this, like especially with the knee injury. You really have to baby the knee for a long time. There isn't much blood flow going to the meniscus, so I'll have to stay off of it for I think 6 weeks or something like that, and with a knee brace. So yeah, a lot of recovery, and I think why it's hitting me is because I wanted to actually compete this summer in a specific competition that was in it was at the end of June. That's not gonna happen. And yeah, so I think I'm kind of just processing that and knowing that's not even gonna be an option for me, possibly not for another good while, because it's gonna take me a bit to recover and build up muscle again and build up more muscle, because I'm still not really at a place where I want to be to compete. So I guess I'm just feeling a little frustrated. The patience is the game. I've done this before. Doesn't make it any easier, doesn't make me hate it any less. But I know that I can do it, and I will. But I'm ready to not have to do this kind of thing. Yeah, so bumming a little. I'm bumming a little, I'll be real. I'm getting balls and it's amazing, but I'm so over the recovery, especially knowing that it's not going to be my last surgery because of the knee thing. So alright guys, that is it. You're probably bored to death listening to me talk. Peace out. I'll see you next time.